So hey guys, hello, namaste. I am Ajay, a final year student from DMS of Philippines. So this is my the uniform, current uniform in the final year. So this is the silver badge. So this is the silver badge in case I am a final year student. Okay, green badge means first year, yellow is second year, red is third year. Okay, so in this video I would like to talk about guys the what is how will be the OSCE and the simulation experience here in DMSOF, not only in DMSOF but also in all about the other colleges also. Okay, so guys, we are going to have the next examination maybe. Okay, so in next examination we are going to have in step 2 we are going to have the OSCE related questions and simulation also. So here in DMSF guys, the OSCE and the simulation is very common, it's very famous. Okay, the simulation and OSCE will be start from the third year. Okay, first of all, let's discuss about the simulation. What actually you are going to do in the simulation? Okay, so first of all, as I told that simulation will be starting from the third year. Okay, so what we are going to do in the simulation means what is simulation? Okay, so actually there is a like simulation center in DMSOF, not only but also like all colleges are having their own simulation. Okay, there is mannequins. Okay, there is a mannequin babies or patients, like they are similar to the real patient. Okay, they are going to examine the patient eye. The people can constrict. Baby can respond to anything. Okay, that they act like this real patient. Okay, so guys, what we are going to do is that starting from third year. So suppose we are going to suppose they given a case about the pneumonia. Okay, suppose a small baby got pneumonia. Okay, so we are going to manage the patient. Okay, suppose patient came here. Okay, so we are going to enter in the emergency room. There is okay, so before going to treat the patient in the emergency room, we have to collect the information. Okay, so before collecting information, our doctors, they will act like the parents to the patient. Okay, so they will tell and they're going to divide us within like a 5 members, 6 members, like that. Okay, so like 5 members, we are 5 members groups per group. So they're going to act like parents. So they'll ask, doctor, my baby is crying and chief complaint is a cough. Okay, so we have to ask, ma'am, from how many days the baby is coughing, ma'am? You have to ask what is the characteristics of the cough. Okay, is it productive, non-productive, and also is there any associated symptoms like fever, rashes? You have to ask everything. You have to take the all history. Okay, before going to the emergency, and then later we are going to the emergency room. It's the sim. As you know, guys, if you're having the first experience in a sim, it's very tense because we are going to save the life. Okay, so there is a mannequin. The condition is a pneumonia. The baby is crying. Qua. It's a real patient, like the baby is crying. Heart rate is there. Respiratory rate, all is there. O2 saturation, all are there, and there is a nurse. Okay, so we are going to manage the patient. So how you are going to manage the pneumonia patient? So first of all, guys, you have to while going to the ER emergency room, we have to first of all check the vitals. Okay, we have to just say our doctors will observe how we are going to manage the patient. They don't do anything. Okay, because we are the doctors. So first of all you have to check the vitals. You have to check the O2 saturation. If it is less than 94, we have to give the O2 sat. Okay, so how much liter you have to use? Suppose example, the patient O2 saturation is less than 95, you have to give the 5 liters of start with 5 liters of blood, 5 liters of oxygen per minute. Okay, if the baby O2 saturation is greater than 95%, then you can start with the 3 liters. We have face masks. Okay, PDI face mask. Then you have to give the IV fluids. you have to give the plain normal saline solutions. You have to calculate the how much cc you want. So if you are going to ask, nurse, please give the IVF, she will ask what IVF if you what IVF you want, how much cc per rate, frequency, she will ask. So you have to be careful about this one. Okay, got the vital signs and you get the O2 therapy, and also you have to do the PE. So PE, what you are going to do this PE, you have to check the lung sounds. Okay, you can see clearly the crackles, okay, like this. And then you have to give the medications. So you are going to do like ampicillin or amoxicillin or penji or paracetamol, whatever. You have to give the IV via IV. Okay, so this is the last end. So finally you save the baby. So there will be 50 minutes time to save your patient. Okay, after the end of the simulation, you have to come back to the classroom, and doctor will discuss the case and how we manage civil and how and any mistakes she will tell. Okay, this is what the simulation like in third year, guys. This is, if you are first time, you will be very tense because the baby is crying, and if we are not treating in a good way, very afraid. If you are going more number of times to the simulation, you will get more experience about the simulation, how to manage. Okay, don't worry about that. In final year, you are going to simulation every day. Okay, so next, coming to the OSCE. What is OSCE? Objective Structural Clinical Examination. Okay, it means, guys, there are some stations in this. Okay, there is a room, OSCE stations. So there are many stations like station 1, station 2, station 3, station 4. So this is the exam. Okay, like station 1. Okay, in station 1 there is a computer screen or anything. Okay, so there is a table. Okay, so station 1, suppose example, they told to do the physical examination of the cardiac heart. So station 1, do the physical examination of the heart. So we have to do. Next station 2, there is a chest x-ray, anything, whatever this choice. Okay, whatever, chest x-ray or the CT scan, anything, you have to go and interpret. And station 3, we have in the prescription writing. Station 4, we have in the IV fluids insertion. Like this, there are so many stations are there. So within one station they will give time up to 3 minutes. Okay, so within, like, depends on the station, within 3 minutes for 3 minutes per station. Like within 10 minutes we are going to complete the OSCE exam. Yeah, clinical based exams. Experience. Okay, so if your college having the OSCE and simulation, but you know, guys, in DMSF it's very famous from the third year. So it's very good experience. Okay, so hope this video is helpful for you guys, and please subscribe. Okay, so if you have any more doubts, please ask me. Okay, bye bye.